Hello and welcome to the Accidental Health Show. I'm Dr. David Bohn, and today it's my pleasure to have Dr. J. Kim from Advanced Diagnostic Radiology. He's a radiologist, a board-certified radiologist, here today to talk about all the different studies they offer there and what these studies are for. We're just going to spend some time going through the list. Dr. Kim, thanks for being with us today.
My pleasure.
Pleasure to have you on the show. Why don't you tell us a little bit about where you went to school, why you're here, how long you've been a radiologist. Just give us a little background.
Okay. I've been a radiologist for 12 years, and I grew up in Southern California and went to medical school at the University of Chicago. And I thought I would actually be, as being a California boy, that I'd go back and practice in California. I think life has a way of working mysteriously. After I finished my radiology training at the University of California in San Diego, I got a call from one of the radiologists who is quite well known in Cumberland, Dr. M.S. Kim, who is my partner. He called me up and he recruited me. In the middle of the winter storm, I actually flew to Pittsburgh and drove to Cumberland,
that
2
was
hours.
Your introduction.
That was my introduction to the tri-state area. And when I came here to interview, I was so impressed with not only the radiology practice that Dr. M.S. Kim has built, but just his personality and the fact that his expertise, just overall his person. And at the end of the weekend, I was ready to sign the contract, and that's how I ended up here.
I'll tell you, you've got quite a facility. My patients that I've sent up there for different studies have always said good things, so that's a definite plus.
Yeah. One of the goals that I had when I was setting up ADR, and now we know it as ADR, it's kind of hard to pronounce the long Advanced Diagnostic Radiology every time, it is completely patient-oriented. Okay, from the radiologist down to our staff members, I have stressed from the beginning that if you do not have patients' comfort, convenience, goal, and the benefit as the soul and the main objective, then you do not belong here. And fortunately, I have been able to recruit top-notch staff. They have not disappointed me. So the moment you step into ADR, as you're being greeted at our front desk, that's it. What you need is we are willing to basically cater to you and make sure that everything that you need will be done according to your preference.
But I tell you, that's important too, because I know when people have to go to have many of the different tests you do, they're so afraid. It's usually to find out what's wrong with me, the diagnostic
Absolutely.
part, and they don't know. So the more comforted they are through the process, the better they feel about the whole experience.
And I equate this, hopefully I'm not minimizing the medical aspect, but I equate this to going to a car mechanic. Now, if you are completely illiterate about cars, like I am, basically when something is wrong with your car and you go to an auto mechanic, you are completely at the mercy of those mechanics. You have no idea. You just have to have faith in them, hope that what they're telling you is the truth. Yeah. And at least when you go to the auto mechanics, you may have to wait a while, but they will tell you what is wrong with your car. So at the time you take your car in, you find out what's wrong. Think of a typical radiology practice, typical hospital radiology or any other radiology practice. Not only are you all worried because you don't know what's going on, but you go there, a technologist will snap your picture and basically tell you, see you later.
You never see the doctor.
You never see the doctor, and you're told that your own physician who ordered this test will get the results in a few days. So
usually 2 weeks or 3 weeks.
Sometimes 2 weeks or 3 weeks. And hopefully the least they could do is to generate the report. If you're not going to talk to the patient and cater to the patient, at least the least they could do is generate the report fast enough. On the other hand, that doesn't usually happen. So frequently, patient ends up calling a week later to their doctor's office to figure out, hey, what was the result of my test? That was one thing that I wanted to eliminate. Okay, I felt that if I were sick and if I went to a radiologist, to have, whether it's a simple routine X-ray or an MRI or a CAT scan, what exactly would I want? And immediately, without even thinking, the first thing that came to my mind was, I would like to know the results right away. I would like to know whether I'm good, there's nothing wrong with me, or there's something serious wrong with me that requires immediate attention. And basically, that's how I designed the ADR, and that's how we operate. And partly thanks to that, we have been extremely successful. And when you ask our patients, inevitably, all of them say that is the best features. All the other things about being treated courteously, as well as no waiting, and you guys are so efficient. All that stuff are excellent too. But the main point that they stress is, I love the fact that as soon as my exam is done, you are already calling me, and you're showing me my pictures, and you're discussing with me my results.
And what you said there is really true. There's an old saying that says, people really don't care what you know until they know you care.
Right.
And that's exactly what you're saying. You have all this advanced stuff in the background, the latest cutting-edge technology, but if the person doesn't feel like the facility in general, the staff, the docs care, something's missing.
Yeah, what good is having the best technology and the best radiologists if patients feel that they did not get the type of service that they wanted?
So let's talk a little bit about what you offer there. Or maybe we should say, what don't you offer there?
I guess one of the running jokes is that if ADR does not offer it, then it probably doesn't exist. Okay, and that's not quite true, but that's I think we built a reputation as a center that offers the latest cutting-edge technology before anybody, and also be able to offer the expertise.
I know whenever I moved my practice from West Virginia to Maryland, I had an X-ray facility, simple machine there in West Virginia, and when I was going to move, I wanted to add digital technology, and when I looked around at the cost, I couldn't even get close to the quality stuff you had, and so of course I just send my people up there, and so far we've been very pleased.
Right. I mean, think about I guess I could go on and about all the modalities and all the technologies in which ADR was the first. Okay, but let's just concentrate on few really flashy technologies that we have, and that probably deliver the most benefit to our patients. Number one is a thing called PAC system, all digital technology. Now, obviously, most people are not quite familiar with exactly what digital radiology technology means. You know it because you're in the medical field. But PAC system stands for Picture Archiving Communication System. That's PACS. And that has become essentially the norm and the standard. Why is that? Number one, traditionally, we used to basically, when we snap your pictures, we had to actually slide the film in to this processor full of chemicals, wait 2 minutes for it to develop, then you actually are holding the actual hard copy. Okay. Now, if regular photographers are moving to digital cameras, we said, why can't medical technology move that way? What are the benefits of digital technology? Number one, you don't have to deal with hard copies. There's no reason to store anything. You don't have to have a huge building storing patients' films, and then if patient comes back, you have to go back and dig it up, and that's all. A lot of is very inefficient. Human resources are wasted, and there's much delay in with the paperwork and trying to retrieve pictures.
Even from the aspect of when I want the films, and I call you up, and it's plain film on hard copy stuff, it has to be mailed or hand carried,
exactly.
And it gets lost. Right. And
with the digital technology, essentially the moment the technologist snaps the picture, it is available to the radiologist. So there's essentially no delay. Yeah? And the quality itself is also at par or if not better. Secondly, with that digital technology, now the information can be sent over the internet or over the any type of a communication network to any place in the world. You don't need a special computer. for our referring physicians, such as you, to actually look at your patient's pictures, it's right there.
And if you want to make an area darker or lighter, it's
you can change
easy.
It's easy.
No repeats, very less, or
Yeah.
lower repeats.
Lower repeat rate, and the reports are always attached to it. In the old days, you got the pictures, then you got the report.
Then you
regular
got to dig
paper,
and
you
see
have
if
to dig
they-
through.
see if you can
None of
find
that stuff. Pictures are always pictures, and the reports are always attached. So for a referring physician, from their own computers, okay, they don't need any special computer, just a regular laptop or PC. Type in, and then all their patients show up.
And one thing that people may not know that it really kind of let me blow your horn for a minute is that in the area, I have friends in Hagerstown. It's not available there. I have friends up in Pennsylvania, not available to them as well. So this PAC system is kind of unique.
Yeah, well, now that you're going to blow my horn, actually, let me just even extend it even further. As you know, beside advanced diagnostic radiology, we cover 5 other hospitals in West Virginia. Okay? Grand Memorial Hospital, Potomac Valley Hospital, Hampshire Memorial Hospital, and Hamilton and Pocahontas. These are relatively small institutions. Okay? And most hospitals, even much bigger hospitals, do not have this type of a digital technology or picture archiving system. Okay? And way from the beginning, from ground up, we were able to, using our expertise, we were able to help these hospitals completely modernize their digital radiology system. So now every one of them have this type of a picture archiving system. And you go to bigger towns, you go other places, there are not that many hospitals, even much bigger hospitals with a lot more resources that have the type of a radiology departments that these small hospitals have.
One of the benefits I've seen that I like, and now because I guess I'm the only chiropractor exclusively using you in the area, is that I'm the only chiropractor who has every film read by a radiologist.
Radiologist, that's exactly right.
So before, I'd take a film, and if it looked questionable, I would send the films out, usually to your facility, and it would be read. But not being a radiologist, there are things that, well, did I miss it? Well, I hope not. Over the years, so far 17 years, I don't know that I have, but that's a question, and it's a good feeling for me, not only as well as for the patient, that when they're sent out for that study, whether it be in a small clinic or whatever, it's also being read, and that report is being sent to me so that I know not only am I looking at structure, but also any other pathology that may show up in an area unrelated to their complaint is being looked at.
Exactly. I think I'm glad you mentioned that aspect. Whenever I see a patient from your office, I am, of course, discussing the results with the patient immediately, and most of them can't believe how quick it is. Literally, I'm calling them to discuss the results before they haven't even had a chance to dress after the examination. So I'm talking to the patients, and usually, clearly, I'm looking at those films from a different perspective than you are, okay? And I look at them to make sure there's no obvious tumor or cancer or other things or broken bones and those kind of things. And I tell the patient I don't see anything significant. Okay? However, one thing I always remind the patient is that Dr. Bohn is looking at these pictures from a different perspective than I am. Okay? I don't have enough of a chiropractic knowledge to tell you what are all alignment problems, other things that he may be interested in. Therefore, I'm going to read this X-ray as normal, but you need to basically consult Dr. Bohn from his perspective whether it's still normal. So I think it's important that this relationship be complementary.
Absolutely.
Yeah, rather than adversarial.
And that's a good, in my view, that's a good thing.
Oh, absolutely.
That we're looking at it from both perspectives and it's being covered. And patients appreciate that. I'll sit down, I put the X-rays up, and I'll say, did the doctors go over this with you? Because it's you or somebody else.
Right.
And they'll usually say yes, or no, I didn't bother. Then we pull up the report and we go over it and I say, okay, no, he said this is normal, but you have this, this, or this.
Right.
And so far, that's a...
Yeah, I think that's, and when you order an MRI, of course, I'm looking at an MRI and I tell the patient, I don't see any disc herniation, or sometimes I see some arthritis. Okay? Inevitably, they will ask me, well, should I continue with a chiropractic therapy? This is a clear 90% of patients would ask me that question. Now, one of the things that my usual response is, unless there are findings that I feel are somewhat can present as contraindications, such as a large disc herniation, which manipulation may worsen, or if there's a clearly, obviously, sign of tumor or other things, then that takes the precedence over anything else. My typical response is discuss with Dr. Bohn, okay, about what exactly that you guys are trying to achieve. Is it pain relief or other things? Because I don't see any contraindication here for chiropractic.
Yeah, that's one of the things unique about us is when the person does have a large herniation, we have what's called spinal decompression treatment to virtually high-tech traction to decompress or try to lower the inside or the, for the person listening, the pressure inside the disc and pull that pressure off. And that's about 84% effective and has been. Then there's still the person that I tell people, sometimes you have a small herniation and you're going to require surgery. Right. And sometimes you have a large herniation and you don't have neurological signs, you may do quite well. So it just depends.
When I see a, I know like sometimes you have some question about why is it that some people with a large disc herniation don't seem to have too much symptoms, whereas other people with a very small disc herniation may have extensive symptoms. I don't. The quick answer is I don't know.
Because we're all different.
Everyone's different. Everyone's pain tolerance is different. From my point of view, when I'm looking at the MRI pictures, what I'm looking for is there a clear-cut nerve root impingement or compression? One of the beauties about MRI is the fact that we could see all the nerve roots, individual nerve roots. So if you have a disc herniation and you have a very wide canal where there are lots of rooms for the nerve roots,
probably not going to be a problem.
It's probably not going to be a problem. On the other hand, if you have a very small canal, even a small disc herniation, has a higher chance of compressing the nerve root. And quite frequently, I could see the nerve root being compressed on the disc. Whether it's a bone spur or a special, fluid-filled structure called synovial cyst or a disc herniation, if I see a clear-cut nerve root compression and I ask the patient, which side is your symptom, and it corresponds to the patient's symptom, then that's a pretty good evidence that is what's causing the patient's problem. So I think
why don't you stop there and explain for the person that I'll get asked this, maybe they ask you as well, but I'll say I'd like to get an MRI of your low back or your neck, and the patient says, well, is there a lot of radiation with that? Could you take a moment and explain the difference between what's happening with MRI and why it shows the nerve better than the X-ray for the person listening?
Yeah, let's see. Let me see if I can explain this without, talking about a lot of technical jargon. Basically, MRI has no radiation. So let me just get that out of the way. Unlike CAT scan or regular X-ray, MRI basically uses a different type of technology. Therefore, it has been shown even safe in pregnant women. In fact, we do MRI of the fetus in uterus. So that's how safe it is. There's always a talk about whether MRI can cause heating or vibration, but that's really hasn't been proven, and that's really of no concern. So no radiation risk. And the reason the MRI is so exquisite in delineating the soft tissue structures. By soft tissue structures, I'm talking about nerve roots, something that are not bone, muscles, tendons, ligaments, is using the special, every cell in your body has its own resonance or its own magnetic resonance. What we're doing is essentially taking advantage of the difference in the amount of magnetic field of different cells and using that difference to generate pictures so that if a certain cell or tissue has certain amount of magnetic field, then it shows up as a different color picture or different structure than, let's say, muscle or others. That's, in essence, hopefully, I didn't confuse anybody. In essence, that's what it is.
The bottom line is there's no radiation.
There's no radiation.
There are no known side effects.
Correct.
And here's a question. The person that's been a welder and they need to have x-rays of their orbits. For the person listening again, why is that necessary?
Right. The reason that's necessary is because when you go into a MRI, your body is going into a very strong magnetic field. Okay? Therefore, anything metal is dangerous. If the metal is what we call, fancy language is ferromagnetic, that means it's actually conducting magnetic field, then it will be influenced by under the strong magnet.
In other words, it could move.
It not only can move,
come right out.
Come right out, and it could be very dangerous. So that's the reason why if you are a welder or anybody who works with the metal chips, we always ask you and pre-screen you. And if that's what you do for a living, we check your orbit to make sure there's no, if there's a small chip on your facial soft tissue, it's not as dangerous as having it in your eyeball. Okay, that's a serious problem. Clearly, we think more about vision than leaving a little scar tissue on your body. And sometimes patients ask, I just had that orbit cleared last time I had MRI. Why should I have to do it again? Well, that's because you're still working here. You're still welding. So just because you didn't have any metal chips in your eyes 6 months ago doesn't mean that you don't have one now. So
and that's it's all about safety.
Yeah, and typically there is no extra charge. We're doing that purely out of concern for the patient, not only to protect the patient, but also protect us legally. And I think that's just a standard practice if somebody says that. And for the same reason, we ask patient, do you have any type of a hearing aid? Do you have a pacemaker? Do you have an aneurysm clip that's not titanium? Now, if it's a titanium, it's safe.
It's surprising to me, though, how many times you ask a patient that, and they don't even know it's
right.
there.
Typically, if you had the aneurysm surgery before 1980, I think those were not titanium clips, and they're not MRI safe. So that's cut off. But we would like to ideally have patients' surgical record.
To know for sure.
Yeah, and they call those surgeons. Last thing we want to do is rip off the aneurysm clip in somebody's brain. So those are all contraindications.
Okay, another new technology that I know you have up there that people really don't know much about is PET scan.
Okay.
Let's talk a little bit about what PET scan is, what it's looking for, what happens. Would you be willing to talk a little bit about that?
Yeah. Let me do a little shameless self-advertising before we discuss PET scan. As you know, ADR was the first center, probably in the wider area, Mid-Atlantic area, to have actually our own PET scan inside our center, open 5 days a week. Okay? It is offered to our patients full-time as a fixed center. And we also use the latest technology. The first generation PET scan used a crystal technology called BGO, and that is, it's okay, but it's still a first generation. There's a reason why there's a second generation and third generation. And most of the latest generation PET scanners have special technology called GSO and LSO crystals. That's what we have. Okay. Until ADR acquired this PET scan in-house, everyone else had just a PET scan coming in a truck once a week, once every 2 weeks. Now Morgantown had a PET scan before we did, but besides Morgantown, we were essentially the first to offer this technology. Okay. So having said that, let's discuss what PET scan is. Now PET scan stands for positron emission tomography. Okay. And it's a very mouthful and fancy name. Main use for PET scan is in the arena of cancer diagnosis. We also use that for heart to find out which portion of your heart is not receiving enough blood and therefore starving of oxygen and food. But the vast majority of the current application for PET scan is in the arena of cancer diagnosis and cancer follow-ups. Okay. The way it works is essentially, we inject the patient with a special sugar that is tagged with a radiopharmaceutical nuclear substance called F18, deoxyglucose. And F18 emits as part of its decay. As it goes away, it sends out particles, gamma rays, which are then picked up by the camera and the pictures are generated. Now, why is PET scan useful? The reason it's useful is we know that since it's a false sugar and your body uses sugar as its main source of energy, any place that is very active and dividing and growing are going to take up a lot more sugar. And since your body does not know the difference between a false sugar that we attached to this F18 versus the real sugar that it normally uses for food, this false sugar is going to go to a place which is very active and dividing and growing.
Cancer.
Cancer, exactly. So most cancer cells are actively growing and dividing, and therefore it's going to take up a lot more of this false sugar. And as this F18 decomposes or it goes away, it's going to send out all these gamma ray pictures.
Show up as the hot spot.
It shows up as a hot spot, exactly. So to very simplify it, when we generate a PET scan picture for cancer patients, what we are doing is we're looking for all the hot spots, i.e. dark spots. And then we decide, okay, which one of those are normally dark? Now, I tell patients, your brain should be dark.
It should be active.
It should be very active. We hope your brain is very active. So your brain is normally very hot, okay? So don't worry about it. Thyroid can be slightly hot, so that's not a big deal. Unless I'm working the patient up for thyroid cancer, then that becomes a little bit of an issue. Salivary glands, okay, the ones that make your saliva can be hot. From time to time, your colon, bowel can be hot. Yeah. And of course, this stuff is, your body gets rid of it through your kidney system and the bladder. Therefore, kidney and the bladder are going to be hot. Now, aside from those normally hot places, nothing else should be hot. So when we see those other hot spots, then we focus on those. And that's basically how we use PET scan. And in a very simplistic term, that's what PET scan is. Now, these days, where are we using it mainly? And I'll discuss some other exciting areas that we're using PET scan for. Breast cancer diagnosis. For a lot of women patients, who are unfortunate to have breast cancer, PET scan has been a very useful tool because we can relatively accurately stage them, and then even the initial stage, decide how far this thing has spread. Second area is colon cancer. Very excellent. Because colon cancer it makes a huge difference whether the cancer is confined to the colon or it has already gone into liver and other places. Other places are lymphoma, fairly common situation, common cancers in this area, as well as head and neck, squamous cell carcinoma of your throats and tongue and all the other places.
From all the tobacco use.
Exactly.
Well, unfortunately, we're running out of time today, but hopefully we can get you back another time to talk more about all the other things that are going on up there and studies that are happening. And if people want to reach you or have questions about ADR, we'll put the number on the screen here. Anything else you'd like to say in closing?
I didn't even know that the 30 minutes had passed so quickly, but I would love to come back, and I think what you're doing is really a great service to our community and to our patients. Not only are you informing them about all the medical expertise that are available in our community, but the fact that you are also familiarizing our patients with alternative forms of therapy, I think that's an excellent thing. Growing up in Korea, basically, I'm very familiar with Chinese herbal medicine and acupuncture. That's all we had when I was younger. So I think more power to you.
Well, thank you, Doc. Yeah? It's a pleasure having you on. And remember, tune in next week for another episode of the Accent on Health Show. I'm Dr. Bohn. Keep the accent on your health. Have a great day.